Upon entering the delivery room for a vaginal delivery, you will first don the appropriate attire: a hairnet, a surgical mask with eye shield, a surgical gown, and sterile gloves. You will notice the table in the back of the delivery room with several instruments. Those most important for your knowledge include the umbilical cord clamp, the red top tube, the Kelly clamp, and the bandage scissors. As you can see here, the patient is in dorsal lithotomy position. As the head begins to stretch the skin of the perineum, the provider places one hand for perineal support and the other hand is used to provide gentle pressure against the fetal head to allow for a controlled delivery. These measures are taken to reduce the chance of laceration both towards the perineum and towards the urethra. Once the head is delivered, it should be allowed to restitute or turn towards the left or right. The provider then places their hands in prayer position on either side of the infant's head. It is important that the fingertips are pointing in the direction that the infant is facing and the thumbs are pointing towards the back of the room. Gentle traction is applied in a downward motion for delivery of the anterior shoulder. Once the anterior shoulder is delivered, the provider uses one hand to cup around the back of the infant's neck and an upward force is applied. With the other hand, the provider is keeping the infant's posterior arm and leg adducted to the infant's body for controlled and safe delivery. The infant is then placed on the maternal abdomen. The umbilical cord clamp is placed on the umbilical cord approximately 2 finger breadths from the infant's abdomen. The Kelly clamp is placed distal. The area between the clamps is then cut with the bandage scissors by either the support person or the provider. The blue bucket from the back table is placed between the patient and the provider. The red top tube is then used to collect blood from the umbilical cord. Once collected, the tube is handed off. The Kelly clamp is then placed across the umbilical cord near the perineum. Be sure not to include any of the patient's tissue within the clamp. The provider then uses one hand to apply suprapubic pressure, while the other hand applies gentle downward traction to the umbilical cord. The application of suprapubic pressure is important to decrease the risk of uterine inversion. As the cord lengthens, the provider advances the Kelly clamp for optimal traction. As the placenta is expelled, the provider uses a twisting or rotating motion in an attempt to deliver the placenta and membranes intact. The placenta is placed in the blue bucket and removed from the field. Uterine massage is then performed at the level of the umbilicus until the uterine fundus is firm and bleeding is minimal.